You are listening to the Women's Gut Health Podcast. I'm Molly, integrative functional dietitian, ex-chef, and gut health expert. If you're struggling with constipation, diarrhea, or bloating, I know exactly how you feel because I've had Crohn's disease for almost 30 years. Each week, we'll dive into symptoms, trends, recipes, and navigate the complex landscape of women's health together, all based on scientific evidence, but in a way that makes sense. Ready to understand your body? Good. Let's go. Hi.
Hello.
Welcome back. We're so happy to have you. Okay, so
Happy to be here.
so happy to be here. This week, we are going to talk about hormones, specifically estrogen, as it relates to anxiety and constipation.
Love it. Good. This is such a fun topic.
What to do. And then we'll give you some action tips, and then we'll talk a little bit about some detoxification stuff as well. But before
Love
that,
it.
what was the best thing you ate?
Oh my gosh. So we were down in Bend this weekend and with all the kids, and there's like four between myself and my partner, there's four hungry boys to feed. And so we decided to utilize the air fryer and we made air fryer wings. And they
Ooh.
are so good. They're better than any wing I've ever had eating out, and they're not deep fried. You know how most wings are deep fried, which is just like a gut ache waiting to happen,
Mm-hmm.
and just such gross oils. We just the boys I was like, okay, I'm feeding you. I'm not deep frying them, so I'll put whatever sauce on you want. So they used Frank's red hot sauce, which who knows what's in there,
Mm-hmm.
and then some barbecue sauce, and then we have a teriyaki we've done at one point in time. But they were really, really good. I was shocked at how delicious they were. So good. We made some potatoes and a bunch of veg along with it and had a salad. It was really nice. And they just ate it all up. It was awesome. Everybody had a really dirty face and hands, and we just kind of went for it. It was really fun.
Oh, that's awesome.
Yeah, it was fun.
Awesome.
Yeah. What about you?
I've got to say, it was probably so we have a rotisserie attached to our grill, and
Oh, nice.
so we'll like do a quick little brine or something on a chicken and then rotisserie it. And it's nice because it's not like, the chicken you go to the stores in the plastic bag, which is fine if you're in a pinch, but I don't like to make it a habit.
Yeah.
And rotisserie chicken is just so easy to like then have leftovers and throw it in salad and whatever else. So it's a
Yeah.
nice, yeah, it's a really nice thing. So that was absolutely delicious. We had it with baked potato and broccoli rabe, which I love.
Yum. So what do you put before you put it on, if you brine it, what do you put anything else on the outside of it to make the crispy, yummy skin all flavorful and whatnot?
So the brine's got a little bit of sugar in it and a little bit of salt, a lot of salt,
Yeah.
and then herbs,
That's what they are.
like a lot of
Yeah.
herbs. So all I'll do,
Okay.
because like in the rotisserie, the chicken is not going to get crispy. It's going to be more, I mean, it will, but it's not like if you bake it, because of
Okay.
all of
Okay.
the juices always running over it.
Okay, I gotcha.
So really, it's just I'll put half a lemon, half an onion, and then some herbs inside,
Okay.
and all of that just kind of like melts all around in there.
Oh, that sounds so
I
good.
know it's
I
really
need
good.
I need one of those in my life.
Yeah, yeah. I mean, it's actually really like not very difficult to do, and the grill wasn't like overly expensive, so interesting.
Yeah. And so how long does it take for it to cook?
About 2 hours, 2.5 maybe. Do it pretty
Oh
low.
my gosh, that's not bad at all. So
No,
just like midday, you're like, I'm gonna go out and get the dinner going, honey.
get that chicken rolling.
Seriously, literally rolling.
Literally. You just can't
It's
do it
out there
in the
doing
rain
somersaults.
because you have to
Oh,
plug in the thing that spins it. It's like a rod that you insert into a little piece that it's almost like a music box, except instead of a ballerina, you put the rod in for the chicken. The chicken is the ballerina.
oh my God. So it's called a chicken box,
Yeah. Yes,
essentially.
exactly. But you can't do it in the rain.
Okay.
Um,
Oh, okay.
okay. And then a post that you saw on the internet.
Oh, well, I just love Dr. Karazian, and I felt like this post was really good with what we're going to talk about today. And he was just exploring the research from antibiotic use in that it can take sometimes up to 2 years to have your gut microbiome return to its like normal state after one dose of antibiotics.
Mm,
2 years.
yep.
And I think sometimes people just will be like, what's going on with me? Oh, I had this bladder infection, so I took that, and don't really think in their mind that that might be the cause of some other underlying kind of like slower building chronic things, maybe 3, 4, 5 months after.
Mm-hmm.
And I grew up in a generation where it was handed out all the time,
Oh yeah.
and I think it still is in a way. I think we're a little more educated on using it very appropriately. Um, I had a ton of it when I was a kid. I was very sick. It's one of my part of my story.
Mm-hmm.
Um, but yeah, I think it can be, people can really underestimate how it literally changes structurally. It changes your ability to be able to absorb, it changes the ratio of bacteria. It can, it's like an herbicide for your digestive tract. It comes in and it clears everything off, but then we don't really know how things are going to repopulate.
Mm-hmm.
It's different for everybody. And so I guess I just kind of wanted to throw that out there. If you're in a place where you're getting antibiotics, I've always recommended in my practice, probably the last 10 years, to actually pair probiotics along with your antibiotics to negate some of that complete loss of the microbiome diversity.
Mm.
Yeah, I love the two together. And I know some people would be like, no way. And some people are like, keep them 2 hours apart or whatever. But I think the research is starting to show that it's better to have them together.
Mm-hmm.
What do
Mm-hmm.
you think? What do you think when you think about antibiotics?
When I think about antibiotics, I definitely think about how one of the questions on my intake questionnaire for clients is, did you have frequent antibiotic use as a child?
Mm-hmm.
Because definitely we are, wiping things out nowadays. They're saying more about probiotics. Obviously, probiotics more part of the conversation and all of that. So, I think that parents are a little more curious,
Yeah.
and that's because they have more resources. I mean, you weren't going to go to the
Mm-hmm.
library and look up like, what do I do if my child takes antibiotics for their gut microbiome in the 80s? So
Oh, that's
that
cute. Yeah.
that times have changed, and so I think that's fine. I think also some antibiotics they say aren't absorbed in other places, and I don't know about all that. I think to some extent when you're taking antibiotics you are, especially a couple days in, going to have some kind of stomach issue. So just keeping in mind that yes, it can absolutely kill off a lot of the good bacteria in your gut because it's killing
Mm-hmm.
bacteria and it's not necessarily selective. Um,
Right.
and also, having a family member that has experienced sepsis, like a really severe case of
Mm.
life-threatening sepsis, and them needing to be on, like, there was like one particular antibiotic that worked for, it was a whole thing. um,
Yeah.
but imagine if you just kind of took antibiotics because it was convenient or because you felt like you needed them or whatever, and then when the time came and you had life-threatening sepsis, you couldn't take, like, the antibiotic that they needed didn't work.
Yeah,
So
you kind of became a little resistant, and that is part of the picture, when you take them, is you're
right.
giving yourself an opportunity to learn from it. Like our bodies are
Yeah.
meant to learn from what you put in. Mm-hmm.
Right. And so, very concerning. But also just, be judicious and understand, always ask, is it necessary? I think giving yourself some time to try to recover from a cold before you go straight to antibiotics is always helpful. But I'm not a
Mm-hmm.
doctor, so I have no opinion
Right.
in
It is
terms
out of
of
our
that.
scope to suggest that for sure.
But what I do know
um,
is that as a provider who helps people with stomach issues, that one of the side effects of antibiotics is that it can cause diarrhea or constipation. And
Mm-hmm.
another thing that I see very often is people take them when maybe they didn't quite need them yet. And they
Mm-hmm.
say that, oh, I took antibiotics, it didn't work for my cold or whatever. So that's all I'm saying. Is like in my experience I've heard. Right.
Yeah. Yes. And they bring on pretty, like some people just have, maybe some intestinal dysbiosis already, and then they end up with a yeast infection after they've taken them. I
Hmm.
see that very commonly,
Hmm.
which is such a bummer where you're
I
like, dang
know.
it, you tried to kill one and then something, it's like you're playing whack-a-mole, you hit
Yep.
something, then something else popped up, and you're like, oh, geez. But kind of unwinding and looking at all the different areas where you can attack your immune system from a different way. I mean, we love them. We're so glad. I'm so glad antibiotics are on the planet. I've used them before. Luckily, my boys have never used antibiotics. They're 11 and 13. They have
Wow.
neither one of them have ever taken them.
Huh.
I
Wow.
know. I'm like, wow, you guys are lucky because they eat way more sugar and junk than I would like for them to. But I'm like, hey, well, at least your gut's handling it.
Perf. Love it.
Yeah, exactly. What about you? What did you come across this in the World Wide Web this week?
So there is a doctor on Instagram who I love, Gut Love, and she had a post that said 30% of people on acid suppressants develop SIBO. What are acid suppressants? Pepsid, Zantac, omeprazole, pantoprazole, that kind of thing. Um, what's SIBO? Small intestinal bacterial overgrowth. And that is kind of one of the things that comes together in a constellation of symptoms to present with IBS. So I think it's very interesting that we remember that, yes, you can, again, right? There are all these miracle cures out there that magically take away what's ailing you, and a doctor can inform you. But isn't it weird that both of those things, acid suppressants and antibiotics, can also cause some issues with the gut? So again, make sure you're having an informed conversation with your provider, and understanding that, per the American College of Gastroenterology, acid suppressants are for use for like a short period of time, 3 months or so,
Mm-hmm.
to
Mm-hmm.
heal and calm down all the acid. Now, if it doesn't go away, that's where I would encourage, ask for an endoscopy, talk to your doctor about
Mm-hmm.
what could be causing this heartburn or this
Mm-hmm.
reflux.
Mm-hmm.
Don't just settle at, I'll take this forever, because what acid suppressants do is turn off our stomach acid. And our stomach acid is one of the things that kills bacteria that sets up shop in our small intestine. So it's a big,
Mm-hmm.
long, big circle. And, I think it's just a bummer, sometimes, that, again, our society's been taught to take a pill, and sometimes a pill makes you feel worse over time. And then you don't really know what to do, and you're confused because everywhere you turn, there's some other recommendation. So,
Yeah. Yeah. And those anti-acid type drugs and proton pump inhibitors and stuff, in my experience in the clinic in the last 18 years, is people that have been on them for 3, 6 months plus, they're just
mm,
really depleted. There's a lot of things, or there's some nutrients that we need to be liberated via our stomach acid that provide us with enormous amounts of energy. Be one of them being B12, one
that's
of
the
them being
only thing
iron.
that can digest
Yeah.
B12 is stomach acid.
Yes. And if you don't have that, that's a problem.
Yep.
That's a big problem. We need that vitamin for a lot of different things, brain health in particular,
Hmm.
energy. So yeah, those are scary. Oh man.
But
So be kind to your gut. And we
yes,
are so resilient. We really are so
the
resilient.
most. Yeah, there's always an answer. There's always a way out. And even if you feel overwhelmed, like, you and I are overwhelmed, like there's an unlimited amount of
It's so
information out
true.
there. So it's
Mm-hmm.
about personalizing those recommendations to you, having a
Yep.
provider that you trust, and really always, saying, like, on anything. Like, so for me, because this will be what I do, is I say to my doctor every year, like, okay, am I developing antibodies to this? I'm on Remicade for Crohn's disease. Am I developing antibodies to this? Is this still appropriate? Like a biologic, once you go on it, you're supposed to stay on it. That's what they tell me.
Yeah.
So, making sure, like, is this dose appropriate? Is my body still responding to this? Like that kind of thing. And being inquisitive. And I know, like, if I had thyroid issues, I would be asking, like, have we looked at all the levels, or are we just looking at TSH? Like, is there a way to make sure that I don't need a little bit of another thyroid hormone, like a little T3 or a little T4, depending on what I was on? And just
Mhm.
every year reevaluating, because your
Mhm.
body changes so much.
Yes, it really does. And, things get researched further
Hmm.
and drugs become better and holistic remedies, people get more informed.
Hmm.
And yeah, it's such a good little puzzle, but the personalization truly is the key. It's where you find a lot of success.
And as much as we love holistic, we also love the fact that holistic goes hand in hand with medical care. And there are some things like Crohn's disease that you cannot treat holistically 100% in certain instances. I think one rare case here and there where you're not
Mhm.
needing medication, but again, who your doctor is going to make that judgment call. So just,
Mhm.
I think there's a lot out
Mhm.
there. There are a lot of things that people say about just using nature and acupuncture and that sort of thing to heal diseases that could actually require medication, right?
Oh, yeah, every medicine has its limitations on so many levels. Yeah, it's nice to be able to combine them all and find
Yes,
what works for you and make everything, tick for your line it up so your body ticks just right.
exactly right. And then doing the work on your own. Once you get the medical stuff out of the way and you're going every year to the doctor, then you get to experiment with all the fun stuff.
Mhm. Mhm. That's so true. That's so true.
Okay. Well, that was a long one, but here we go with hormones, constipation, and anxiety. Now, what comes to
Yes.
mind when you think of that?
Oh man, constipation, anxiety. Well, I'll start with anxiety because I'm kind of in that place in my life as a 48-year-old single mom running a couple businesses and also going through a large transformation with both of those. There's a lot more output from my stress response being part of the picture. And I've noticed that the feeling of feeling a little anxious and being restless at night, trying to fall asleep, is definitely upticked, and my hormones are definitely fluctuating. I'm in my luteal phase, and I'm in what I would call, so I don't, you're old enough to remember this reference, but some of our listeners may not be. But I call this the Beavis and Butthead stage, where I feel like Beavis, where I'm like, like I'm
Mm-mm-mm.
just so ready to start my period that I could scream.
Mhm.
And there is a sense of anxiety with it.
Mhm.
And a lot of it has to do with just the little symphony of estrogen and progesterone right now in this luteal phase, trying to get to the point where it can, release the layer, like shed the layer of the non-pregnant womb.
Mhm.
And that sense of anxiety, can definitely come during the different phases. Some people experience it more during ovulation, and some people experience it more during the premenstrual or luteal phase. Um, and some, I think in the big picture, just having that sync and being able to, or syncing up with your cycle and being able to recognize that there might be parts in the cycle where your energy is up and it might seem like you're a little anxious, but really you're just super productive.
Mhm.
And then there might be other times where, we're in the luteal phase and our serotonin is dipping. So we have the mood dip and we're, tired, but kind of wired at the same time because our progesterone should be rising, but it isn't in relation to our estrogen. And so we have this sense of like feeling just, the heartbeat increase, and we're a little more, maybe some like palps in the chest, or like a sensation of like kind of in the chest, and just the mind is racing and things. And it can be very debilitating. But I think what's really cool about that is being able to, go back to the gut where you can find some solutions in helping with that serotonin, and also with your ability to be able to absorb and process estrogen makes that time so much more doable, where you don't feel like you want to murder humans for chewing inappropriately. It's just a
Mm-hmm.
normal thing in the world. Oh
Yes,
my God, it's
totally
the
normal.
worst. Yes, yes, yes. Yeah, you must die if you're eating next to me. Um, and then constipation for me, that one is very similar. Like, if with same thing with the anxiety, coming down to the gut and just recognizing that there are facets of our digestion that are really important when it comes to metabolizing estrogen. And I'd love to hear what you think about these, and then maybe we can dive a little bit more into that mechanism.
Yeah, sure. So I was always kind of nervous as a child. And basically when I was younger, I was on edge. I not on edge, but definitely like more introverted. I've always been kind of introverted, so I think there was always kind of a social aspect, and who knows like where I am on the spectrum, but I think I'm somewhere. And all of that to say that, big surprise, I got inflammatory bowel disease at age 15-ish. And the more that I read about it, like, because I had a good, like, growing up, like my mom really made us dinner every single night. Like, I don't understand how she did it because I can't even make myself dinner every single night. But there was a vegetable, and there was always, so I do think that, you know it wasn't so much that I had like this horrible diet as it was that there was a connection with the gut and the brain. And a lot of people, we're just now digging into this, and it's so vast. And it, again, these studies require following. So, like, someone would have had to follow a group of, say, 50, 100 people, just like me, from before they got IBD to now, right? To like figure
Hmm.
out what exactly is going on. And so, or like follow a group of 100 kids who all had similar kind of diets at home and similar kind of socioeconomic status, and then see how many of them got, and then look at their medical record. Did they have anxiety? Like, it's a huge undertaking to figure out
Yeah,
the connection.
yeah.
So all that being said, I'm sure that there is a connection, and I know that because now that I've dedicated my life to having this private practice where I help women who have IBS or IBD or diverticular disease or whatever it is, those are the top three really, that I work with. It's like, wow, we all have some degree of anxiety, certainly. And what we do know about the gut and the brain connection, which is kind of where we get this anxiety and IBS, and I see, 100% of my clients have some degree of anxiety that I would say is just above maybe the normal, but who knows what a normal level of anxiety is in this day and age. Um, but primarily, when we think happy hormone, we think serotonin, and that is made in the gut and sent on up to the brain. So are other kind of neurochemicals. And I think that it's important to know that we have these things and they're sending them back and forth. There is a bidirectional kind of chat. I'm trying to keep this as basic as possible because it is really
Yeah,
complicated, but
yeah, yeah. Like, you
um
have receptors in your brain for these neurotransmitters,
yes.
and then you also have like this second little brain in your belly where all that same stuff
Yes.
is happening. It's just on a different, it's like on level, it's like in the basement instead of on the rooftop.
Right, like in the factory.
Yep.
And then,
Mm-hmm.
yeah. So if we have a lot of stuff going on with our gut and there's overgrowth bacteria and the functions, so if we have like overgrowth bacteria or H. pylori or even, increased intestinal permeability, leaky gut, then all of the functions of our gut are muted, are reduced. And that means that the production of these hormones that calm us down and help us respond to stress and help us increase our tolerance to stress, all of that production is also dampened, right? So that's where I see, that's the easiest way to explain it in terms of anxiety. Does that make sense?
Yes, yes. And yeah, you just your capacity to be able to process like the nutrients that are needed to support those neurotransmitters, the enzyme functions that can help with your hormones, and your ability to be able to communicate with your brain. Absolutely. And I think that, there's more research coming out about more of this leaky brain, as opposed to like if you
Hmm.
have a leaky gut for an extended period of time, that those tissues in the brain might also be leaky. And
Oh,
so
yeah.
having the ability for those two to communicate, with one of them being just overly permeable, you're going to, you might be feeling a lot more anxiety if it truly is kind of coming from the gut.
And something else is that when cortisol is released, so whenever we're stressed out, our body releases cortisol, and that can actually cause some imbalance of gut bacteria. And that can also cause inflammation all over the body, but certainly in the gut.
Mhm.
When we're in that fight or flight state, then we are in a constipation or diarrhea state. I like to say fight, flight, or
Mhm.
freeze.
Mhm.
Because if you're going to go fight, like your body, again, thinks that we're in the ancestral times. That's
Yeah.
kind of the basic messages. So you've got to think of it like it's not I have to take a test today. It's I have to go spearhead a trout for food and I'm going to have to fight a black bear to do it. Do
Mhm.
you want to be pooping? No. So you're either going to hold it in, constipation, or
Mhm.
you're going to let it out, diarrhea.
Yeah.
And I think that that's really another part of it is that, it is like someone asked me which came first, the chicken or the egg. And it's like, no, they're both going all the time.
Yeah.
And so when you have that test and your body is in a stressed state or a state of fight or flight, then your bowel movements are not going to be regulated, which is why if you're processing a lot of trauma, if you're going through a divorce, if your kids are moving out and you're becoming an empty nester and you're trying to decide if you still like your husband, all of
Mhm.
these things are happening and they're putting you in that constant state of fight or flight on a daily basis. Let's say you have a teenage daughter, you know what I mean? Like all of these things are going to contribute to constipation
Yeah.
and to diarrhea. And that's how anxiety, I think, that's the easiest way for me to explain how anxiety can affect your stomach.
Yes. Yes. A
And then in
hundred
terms of
percent.
constipation, it's crazy. Constipation to me is the most fascinating thing. Like, I think diarrhea is the easiest thing to fix. Constipation is way more intricate in my mind.
Mhm.
Um,
Mhm.
Now, do you find that you can, when someone comes into your clinic, that you can tell if they are going to tell you that they have diarrhea or they're constipated?
So, common symptoms with people, just in observation of how they move through the world, if they have like digestive symptoms, is that typically we would look for like a spleen pattern. So, they would maybe have a little more like their muscle tone wouldn't be as toned as you would expect it to be. They might have a little more what we call dampness or adipose tissue on them. They'd have maybe
Hmm.
a little sallowness underneath their eyes, a little darkness under the eyes. Their skin would be a little more pale. Their lips would probably be a little pale. Their hair would maybe be a little thinning. Nails maybe be a little bit brittle. So, um, when I see those types of things, I'm definitely, I mean, we're going to talk about the gut no matter what, but when I see those things, I would maybe pay more attention to, the beginning of the tube to the end of the tube. How are you, how is that person doing in that sense? I would look for those things for sure. And their energy level is a big one too. Like, do they have any energy?
Hmm.
And that's one thing I wanted to add to what you were saying before in terms of cortisol. Like, it gets such a bad rap sometime, but it is like our biggest anti-inflammatory hormone. It's awesome. Like when we have cortisol kick in, when we have inflammatory stuff going on in our body, that is the coolest mechanism ever. However, that usually will happen. And so that's one way in which it can, engage. Like if you have a big inflammatory something, you break your arm, I don't know, swallow something terrible and it's stuck in your intestines, you have something going on in your arteries, like you're going to have a ton of cortisol output in order to deal with the problem. But because it's so intricately related to the fight or flight response, and blood sugar too, those are so tied together. But we move through a world where our ability, or excuse me, our necessity to continuously respond to many different things all at the same time, whether it's our phone or it's an email or our children, or, the person driving in front of you is not driving very safely, or, we have so much more to respond to in our modern world that we have associated a normalcy with a low level, like an IV drip of cortisol being activated. I think it also comes from the inside too, when you have long standing things like IBS or other inflammatory disorders, diabetes, that sort of stuff, that you're asking the cortisol to manage that. And then you kind of get to this place where it becomes completely inappropriate. Like the response is all of a sudden inappropriate. A little bit like we talked about in the last episode with sepsis and antibiotics. Like you don't want your body to get used to that. You want them to work.
Mm-hmm.
And so having the ability to be able to have that resilience and bounce back and forth and know when it's appropriate to engage that cortisol and not engage that cortisol, that's really hard because it's not something that you think about. It just happens. But it does come down to managing your stress and your anxiety, managing your diet so that things like anxiety and constipation aren't happening due to the fact that maybe that response has become a little bit inappropriate, whether it's the long term illness that kicked it in or just like long term stress, like you talked about.
Mm-hmm. Mm-hmm. Yeah. Oh, that's really well put. Now, estrogen can make the colon muscle. So, like our colon, our entire intestinal system is smooth muscle, and it contracts and relaxes and pushes things from the beginning of the tube to the end of the tube. Now, estrogen slows that down when it's high. Um, Progesterone, when that is fluctuating, can also mess with constipation. Certainly, progesterone decreases after menopause, and that can cause constipation.
Mm-hmm.
But interestingly, even if you have high progesterone, that could also cause constipation.
Mm-hmm.
So that's why when we just continue to say fluctuation, it's not just, oh, this is where it is, that's it. It's like these things are fluctuating. There is a term called estrobolome, which is kind of like microbiome and estrogen combined, because there are microbes in your gut that influence how you metabolize estrogen. And so if you don't metabolize it appropriately, then it'll be too high. Or if you metabolize it, or if metabolizing it too fast, it could be too low, right?
Mm-hmm. Yeah, exactly.
And
And that beta
those can
glucan
mess with things.
totally.
Hmm.
And that beta glucuronidase, having did a little deep dive on that, that is a fascinating enzyme to me. So if you have a gut dysbiosis and you've created some, or if there's bacteria in your gut due to this dysbiosis that is creating um, more of this enzyme, the likelihood that you are stuck in this loop of your liver making estrogen, like you've already used it, your liver is processing it to make it water soluble, to dump it into the bloodstream, excuse me, to dump it into the digestive tract for like getting out of the body. But then your digestive tract has this beta glucuronidase in there and it's like, oh, I'm going to change this up again and put it back in the bloodstream. It reminds me of
Hmm.
when I went to the beach one time with my kids. I have the most adorable video of them, and one of them is sitting high up on this sand dune and putting sand into the bucket, and the other one is laughing because he's scooping the sand out of the bucket and throwing it out at me. And so it's like one's going in, one's coming out, one's going in, one's
Yes.
coming out, and you just get kind of stuck in this little loop.
Hmm.
But I mean, I guess I just wanted to say from that and even the cortisol that, our bodies are so fascinating how they have the
Yes.
ability to respond in a way that can create somewhat of a homeostasis with that going on. Like you're pliable. You're the ability to be able to have a cortisol response unless you have like Addison's disease where it's like you don't have any anymore, your ability to be able to respond still is possible. And especially with things like the gut, like going, if you're stuck in this high estrogen creating zone where your liver is overburdened, thinking about supporting the liver and sealing up a little bit of that extra permeability in the gut can create an environment where you're creating a lot less estrogen, and then you're having a lot less acne, a lot less constipation, and a lot less
Hmm.
anxiety. Like, I love this
Hmm.
which one came first? Neither.
Yeah.
They're both there.
They're just chicken it and egging it the whole time. It is a chicken waffle.
Yes.
Um, the thing also about beta glucuronidase is that when it's high, so that's one of the things that shows up on a test that I like to do called the GI map.
Yeah.
Certainly, it's not like you don't need functional testing to heal, but it does give us in the hands of the right practitioner a lot of information that we
Hmm.
wouldn't normally have. Like I can't listen to your story and look at your medical history and your labs and tell you where your beta glucuronidase is. You know what I
Right.
mean? And it's not something that you're going to test like with your doctor. They're probably not going to do that. So what is interesting to me is like this is why just part of this whole picture when it's high it could be stress, it could be a poor diet, it could be
Hmm.
antibiotics, it
Hmm.
could be that your liver just needs a little functional support
Hmm.
and flushing out with something like NAC or glutathione, and all of a sudden now you're losing weight that you never could lose and you're going to the bathroom more normally, and it had nothing to do, I mean, not nothing, but much less to do with dysbiosis, right?
Hmm.
So, like,
Hmm.
I just think that that kind of thing is why, and it's impossible to say all of this all the time, but that kind of thing is why it's like you can't just do one thing that's going to make your gut better. So like with some of these supplements or whatever, like you can take oregano oil and get rid of a few classes of microbes, overgrowth microbes. But then what? Like how's your liver doing? How's your biliary function? Like what's going on in terms of your lifestyle? Are you moving? Are you sweating? Did that help? And then where's the good gut bacteria? What are we doing to repopulate that? And how are you responding? And how are you feeling? And I think the expectation sometimes is, and I see a lot of practitioners that are just remove, remove, remove. So like kill the microbes, kill the microbes, kill the microbes. And then that's it. And then they're like, oh, I don't know why you're not better. And it's like, well, first of all, you need time after you kill
Yeah.
them.
Yeah.
Second of all, you need to support these crazy cycles
Hmm.
like your
Hmm.
liver and your liver's role in if you have too much estrogen.
Hmm.
And is that why, we're seeing constipation, right? Something else that I think is so interesting, not on the topic of estrogen, is that you're in women, the colon is longer. It's like 6 inches longer because it has to go around your uterus.
Ooh,
So
what?
that's why
So
women,
fun.
that's
I've
one of the
never heard that
reasons.
little fun fact before.
I know. That's one of the reasons women are more constipated than men because they have a longer journey.
Yeah, I mean, 6 inches. That's a journey.
Don't we know it? Okay, sorry. I'm sorry. So the whole all of this to say, what can you do if you are constipated or if you're having these estrogen dominant symptoms, which would be what would be some of the symptoms,
Oh man,
Lara,
like
of
yeah.
estrogen dominance?
Yeah, so you see, in Chinese medicine, we tend to see more of like kind of excess type symptoms. Like you might have mood swings, or you might feel really anxious. You might have migraines, some of the weight gain around the middle. You might have some fibroids. You might have some breast tenderness and swelling, some insomnia, and then some other things that are more rooted in like deficiency, right? Like we need to build up the body, like infertility or hair loss, brain fog, vaginal dryness, fatigue, um, reduced sex drive, osteoporosis. Like
Mm,
those can kind of come, all of those things can come from the estrogen. And it doesn't have to be all the time. Like you don't have to be experiencing those symptoms all the time. Oftentimes you're like, well, that went away and now I'm better. And then you're like, dang it, now it's 3 weeks later and I'm going through this again. Um,
hmm.
yeah, knowing where you are in your cycle, if you are a menstruating person, definitely makes a difference with having too much estrogen.
Hmm.
Hmm.
Um, so should you experience this, there are a couple things you can do. Cruciferous vegetables like broccoli, Brussels sprouts, cauliflower, kale, romanesco,
Yes.
all great for natural estrogen metabolism. I have seen people come to me on DIM for years, the supplement DIM,
Yeah.
which is like kind of the sulfuric compounds of those cruciferous vegetables, and they are way too low in estrogen and have made it worse by taking that DIM, which is why, again, you don't just want to blindly take a bunch of supplements for a long period of time.
Hmm.
Um, with constipation, then, so yes, we want to certainly flush out, help with the metabolism of estrogen. We want to help with the liver metabolism as well. Like, that's a weird way of putting it, but ways to support the liver in Chinese medicine. Do you have any of those?
Mm. Ours are right up there with what you just said, the green stuff. We love green things. We love to get movement. We love sweating. We love hot and cold therapy. And we love, responding to the world as opposed to reacting to the world. In Chinese medicine, the liver is like the general of how you interact with your world. So let's say you've come across someone who just lost a partner, and the
Mm-hmm.
general is going to be like, this is a time for you to rally your lung energy and your heart energy. That's where you're going to find your ability to connect and relate to their grief and their sadness.
Mm-hmm.
And so with Chinese medicine, when it comes to constipation, like we think about food stagnation, which is again like that lack of peristalsis and the leaky gut and stuff. And then we think about
Mm-hmm.
damp heat in the lower jiao, like we want to clear and clean out the lower jiao. Typically, what we'll do with that is we'll use herbs that clear heat and dispel dampness. So that you would
Mm-hmm.
usually look like a formula of some sort that we would put together to be able to address that. And then more lifestyle stuff too. Again, we're just responding in a way that makes sense for you. And essentially that would kind of translate as managing your stress. um,
Mm-hmm.
yeah, and we really like self massage too, like on the abdomen itself. And then lastly, just acupuncture in general is what I like to refer to in the biggest of umbrellas is parasympathetic training. So sometimes people will
Mm-hmm.
come in with constipation and they've just finally been able to like be pinned down to a table with the utmost amount of relaxation where they've literally become one with the table. They're in this high vibrational meditative state and they've released so much that their ability to let go and their peristalsis to engage again is so incredibly powerful that they'll sometimes get up and go straight to the bathroom when they're done. Nobody poops on the table, just FYI. Nobody ever poops on the table. Um,
Mm-hmm.
but yes, it can be such a great tool in that sense.
Oh, that's great. That is great.
And we love hemp
Um,
seeds too. I think you mentioned those recently. We really love those.
yeah,
We really love hemp seeds. We like how like kind of greasy they are and that they'll help with the constipation too.
but very, very gentle, very well tolerated. So when a lot of people think seeds, they think like a sunflower seed that's going to give
Hmm.
them abdominal cramping and pain, and hemp hearts are not like that at all. Nutritionally, for constipation, we like fiber, water, and movement. So if you are not getting 25 grams of fiber per day, certainly don't start tomorrow. Slowly increase a little bit at a time, like week over week, because if you go from 0 to 100, you are going to get some symptoms and you may be more constipated because you got like kind of a cement situation going on. Certainly staying hydrated because the colon reabsorbs water and electrolytes. So that means it's going to suck out a lot of the water that you need for like a nice, smooth, easy pass of the stool. So we want to make sure there's plenty of water in there. Moving, getting oxygenated blood to your intestines and helping them move. Certainly when you move, your bowels move, so that's good. And then some fun things when you're sitting on the toilet, you could blow bubbles, or you could sing or hum.
Oh,
because those
yes.
things activate your vagus nerve. So, like, even just bringing a glass of water with a straw and blowing bubbles will relax and almost like massage the nerve that goes from your brain to your intestines, that
Mhm.
gut brain connection. And that can be really helpful in allowing a release of the muscles around, the end of your colon, that sort of thing. So I think that is kind of an interesting thing. You could also use a squatty potty, or put the trash can upside down and put your feet on it so that you get into a more squatting position.
Mhm.
Um, because a lot of people, are hunched over the phone, and that's not going to help, like, anatomically. If you're constipated, that's not going to help. And then my last tip, because this is a women's focused podcast, or those who identify as women, certainly we've got making time. So a lot of times I can tell if someone is going to tell me if they're constipated or not by how they approach the world. And
Mhm.
my more I think a lot of people who are really, really busy, if they don't have, if anything goes wrong in that chain of, which there's millions of energy and systems and everything that is involved between the time that you eat and the time that you poop, we are like, dang, we've got to make time to go to the bathroom, because if you don't have that urgency of, to some degree, like the sensation,
Mhm.
like if you're so busy that you've kind of pushed that away for so long that your body doesn't really recognize it anymore,
Mhm.
that's a thing. Like that's a lifestyle thing. And so the time that you normally do go, which everyone has kind of a time, make set an alarm for around that time. So let's say you normally go in the afternoon at work. I know a lot of people don't, but just if let's say it's the morning then, so if it's the morning, set a timer for 5 minutes, maybe even 3 minutes, and just go in the bathroom and sit on the toilet and just take some deep breaths and kind of calm yourself down, and maybe try to go a little bit and then get out of there. Because obviously, we don't want you sitting on the toilet for a long period of time. That can cause hemorrhoids, and constrict blood flow to your anus, which we don't want. But if you've got to teach your body to some extent that
Mhm.
it's okay and it's safe to use the bathroom. And if
Yes.
you're just out straight all the time until your body literally just makes you have diarrhea for 2 days,
Mhm.
then how are you ever going to be able to take that time? So whenever you want to be the time is when you want to start working that little in, like, okay, body, like, just like you're a little baby, like, okay, it's time to go to the bathroom,
Mhm.
and really create a routine around it, so
Mhm.
that number one, you're putting yourself first, and number two, again, you're teaching your body to relax and let go, because that's going to be really helpful too.
Oh, yes, that's so well put. That's so well put. I love it. You got some sphincter law going in there, which I think is amazing. And the retraining of the timing of the poop, I think is great. Like give yourself an opportunity, because you, like you said, that rush, like the women that are rushing around, they're going to be in that low grade fight or flight, and your body isn't going to prioritize elimination or a poop at that time. It's going to be like, where are we going, what's going next, what's happening? Like it won't even be in your train of thought, because your body isn't
Right.
in that physiology at that time. Like you're not pooping because you haven't given your body 1 second to think about it. You've just been rushing from place to place.
And I know, there's carpool and there's driving everywhere, and then you got to go to work or whatever it is, and there's always something to do. But a lot of the work that I do is as simple as, like, okay, well, where is the time that you are going to create for yourself? And I'm sure, you talk about the same thing. It's like we
Mm-hmm.
can't expect our body to perform
Mm-hmm.
if we're not letting it perform. And again, it doesn't know that you're driving carpool. It thinks that, this is it, you're going to war and you might
Yeah.
die.
Yep.
And no one wants to be pooping at war.
No, not unless you're in the porta potty.
You got to go before or
You gotta go
never.
before or after. Yeah, you're screwed.
So, yeah, I think this has been a really, you've had some wonderful tips about this liver and the Chinese medicine aspect of this. And even like as simple, so if you can't get to Portland, Oregon to get acupuncture from our friend here, then what you can do is literally lay down wherever
Hmm.
and become one with, the bed, the couch, the floor, the chair,
Yeah, just
the place
pull
where
up
there
a
aren't
breath work
people.
thing. Yeah. Well, and that's one
Yeah.
thing too that I wanted to say when you said take a deep breath, that really resonated with me because it reminded me that, in Chinese medicine, the lung and the large intestine are paired together in uh, they're both a metal element, and in order for the downward sensation that we need when we have a bowel movement, like you can tell when you need to go is you have that like down bearing almost sort of sensation and your muscles engage. You can't be in fight or
Hmm.
flight for that to be happening, but you signaling your vagus nerve and your breath to be able to relax and fall into it directly connects to that large intestine. Like the lung and the large intestine are connected in order to have that like smooth muscle relax more and allow you to literally let go. Like the emotion of the large intestine when it is not functioning properly is an inability to let go.
Mm. Mm.
So quit holding on to that poop.
Unbelievable.
I love it.
Um,
Good tips, Molly. Good job. I love it. That was
yeah,
fun.
you
I'm
too.
gonna stop
Ah,
rushing
this is
around
so
and
fun.
make more. I don't have any trouble pooping, but I'm gonna make more time for me to enjoy my poops. Kind of like a man does. I'm always like, why don't I get that time? Because I'm not making it.
Yes,
I'm gonna
but
make it more now.
don't sit in that bowl and cut off the blood flow to your anus for too long because
Correct.
it will give you hemorrhoids, and hemorrhoids never go away.
No, I don't take my phone into the bathroom. I try to breathe. I just try to sit there and
That's
breathe and
very
close my
good.
eyes. I'm like, no, I'm
You
not
can
gonna
blow
bring that in there.
bubbles.
I got my fucking phone. Excuse me. My phone's with me everywhere. That's the last place I want to bring it.
Mm. Um,
Where can
well,
they find you,
I
Liz?
am, oh gosh, where can you find me? Women's Gut Health
Everywhere.
on the places, yes, the places. And then you can shoot us a DM on there. Really, that would be the place to find me. What about you?
Yeah, same. I'm transitioning, so everything's going over to Lala's Wellness. You'll find me there for Supercube if you're in town and you want to get some high-level senior practitioner poking, cupping, all of that. I'm here, and then also the Selfish Health Wellness consults. You will find there too. I'm going through a bit of a transition. My clinic actually closes on the 20th of this month. I'll take
Mm,
January off, and we'll have kind of an
well,
put my head down on Supercube and whatnot. So everything now, I would just say Lala's Wellness, either online or Instagram.
love it.
Yes, ma'am.
Okay.
Thanks,
Well,
Molly. What a
we will
fun
see you
talk
guys
today.
next week. Yeah, thank you. Oh, love
Yeah.
it. Thank you.
Okay, bye.
Thank you for being here today. We are Women's Gut Health on YouTube, Instagram, Pinterest, and TikTok. In the show notes, you'll find the recipe share drive, citations to evidence supporting this topic, and fun links we discussed today. See you next week.